Hello, dear colleagues. How are you? Almaty City, Kazakhstan, Presidential National Hospital. My name is Mynzhylky Berdikhojayev and my assistants Abzal Khairatlu and Enzo from Mongolia, and we have guest doctors from Philippines, Rose and Gitin from India. It's an international team today, and we have a patient with multiple aneurysms. The aneurysm number 1 is right MCA territory microaneurysm on bifurcation. Aneurysm number 2 and number 3 fed from the left side, and it was big aneurysm on ICA supraclinoid and the ACOM territory aneurysm. In 2023, August 9, we placed FD, which is FRED. It's a record, it's a archive, and I couldn't take out, but you can see, you can как будет представить? Imagine. Узнать как будет? Okay, I hope you know this stent. It's 4 markers distal, 4 markers proximal, and the Počta in between. It's a FRED. And FRED was placed. It was the session number 1. And last October, we treated ACOM aneurysm with Leo baby stent assisted, balloon assisted coiling for the ACOM aneurysm. Basilar system is clear. Now, today, it's a session number 3. Let's see the basilar system. There is a coiling on vertebral, but it's okay. It's no need for any additional treatment. And some kink proximal ICA. And last time, if you noticed, the kink was here, now is here, but if we will place guiding up, then all this kink is going up. It's very soft tissue, and it's mobile. And now let's see the ICA. There is a remnant of the supraclinoid aneurysm. At the end of the procedure, we will do CT, and we can see the aneurysm on the supraclinoid. It's remaining 1.5 years after the treatment, but I hope it will disappear in following years, and we can see the thrombosed part. I hope it's okay. And also you can see the ACOM territory. ACOM territory, today we can do like this, it's okay. And yes, it's a little baby stent and the coils. And now aneurysm is occluded. Yes, it's not so dense packing, and it was a little baby placed, and aneurysm is occluded. It's nearly 5 millimeter aneurysm. Let's see, it's nearly, yes, nearly 5. And it was nearly 5 millimeter aneurysm. And this is a angiography from the right side. The aneurysm size is nearly similar to the previous angiography, and we made a 3D first. Just a second. It was a 3D. On 3D you can see there is aneurysm with the small daughter sac on the top. And usually if it's a multiple aneurysm, we are indicating the treatment. And it was some vasospasm, but it's okay. Usually we ask for nimodipine in flashing system, and let's see the images. There is a spasm. Abzal did a heart penetration, but it's okay. After flashing with nimodipine, it should be okay. The plan for this MCA aneurysm today, we will place septal balloon for the lower branch, and then we will place gamma microcatheter inside the aneurysm. We'll place Leo baby stent. We'll place another one coil, small one, 1.5 by 2, and we'll open the stent, and I hope we can finish this aneurysm. Yes, I will never say easy. There is nothing easy in this life, and the simple procedure may be complicated, and the complex procedure could be simple. I hope I want to say good luck, Enzo and Abzal, and for me, and let's start. Okay? Nothing simple. Okay. Let's go. Наш псадовый, да? Чекай Black, Scepter и Gamma. As Gamma is for coiling, and Scepter is for Leo baby placement. I know in some places MCA aneurysm could be candidate for clipping. And patient is lady. Just answered also? And she's 60 years old, yes. 70 years old, yes. 70 years old lady, and I hope this procedure will be okay, but usually after treatment, patients start to be more careful for themselves, and it's also very good for prophylaxis. More than 2 aneurysm, usually nearly 10% of next aneurysm. But when we treat them, they are more careful. They start to control blood pressure. They are taking medication, and they are more disciplined. Yes. Okay. We have 8 French guiding in common carotid, and okay. Нематоп қосылсаңыз ба ташпатны? Okay, nimodipine on board, and let's prepare scepter. Экранды 20 сантиметр аяққа қарай тарта салыңыз ташпатны. Экранды 20 сантиметр аяғына қарай тарта салыңыз. Yes, I asked to pull the screen. Трехходовой экраник керек. Okay. This is gamma. Okay. Аноншный не салсал. Микроплекс. Бір трехходовой аш пересмотрим. Я, аяққа қарай тарта салыңыз. Yes, this is for gamma. Gamma-ны бұрмай қойса болатын шығар. Я тура барады. Тағы да бір 10 сантиметр. Okay. First of all, we will place scepter, but we should prepare, yes? Beautiful. Okay. I took 5 cc syringe. In 5 cc syringe, there is a 3 cc of contrast and 2 cc of saline. It's a 60%. Yes. Then taking up my syringe with this 3-way stopcock, and now starting to push the. First is air coming from the dead space of microcatheter, and all is air, and now I'm pushing the contrast. There is a little hole on the tip of the microcatheter, and at the beginning of septal experience it was recommended to hit it with a steam or heat gun and to just close this hole, but after flashing with contrast, usually it's okay. It's stable, and after placing inside the body, that hole is also closing with the blood. Balloon is okay. Now I just place inside the water and making negative pressure. Okay. It will take some time, but inside the artery is more quicker after first inflation. My friend and my teacher Rene is doing in a little bit different way. I will show you how he is doing. Now I will try to do it in classic way of preparation of balloon, and I will show you how to do it in a more accurate and correct way. It's a human factor. Sometimes we can forget about the contrast, and some part of air could be in the system. It's a part of life. I think everybody could experience it. Yes, now we have a septal. Okay, Rene is doing in Professor Chapeau. Yeah, doing in a different way. He's compressing the balloon, then he's putting under the water and inflating the balloon. All air is coming out, and then balloon is ready. Okay, it's a second way how to prepare dual lumen balloon. We have septal and we have eclipse double lumen. When you're doing like this, it's saving time. Yes, it's very quick. Okay. Just a second. We need to place our guiding in just beginning of ICA. Yes, because of the tortuosity, there is some technical points. Huh? Okay. Let's see. Yes, this is IC. I just need to push my guiding a couple of centimeters. Yes, there is a kink. That's why it's a little bit problem. It might cause the dissection. That's why we need to be very careful when we will send our micro catheter up. I will pull a little bit my guiding. Now it's more safe. It's very tortuous. Okay. How is Rene doing? After placing the microcatheter in the cervical ICA, Okay, let's do roadmap. It's a zero roadmap. And then to check the balloon, you just inflate. Balloon is ready, yes, and you can see the balloon. And then we deflate it. Тоже ол бұрыннан сондай. Yes, it's deflating. Okay, now balloon is completely deflated. I will push out air from the system. This is classical way. Now we are sure that balloon is patent and balloon is visible and there is no air in the system. Yeah. Okay. Smart mask. Yes, it's also possible to do half T-standing with the flow diverter stand. To place the FD in lower branch, it's also possible. Navigation should be not so complicated. Yes, that's okay. This straight segment is better. But after placing the scepter, we could change the anatomy. It's very soft structures and usually the anatomy is changed after placing the normal. It's okay. The coiling microcatheter is Gamma 17 from company Balt. We didn't shape the microcatheter because the segment looks like quite straight. But sometimes 45-degree angulation is more useful and it's better. Okay. Now micro catheter came without any problem. Sometimes when there is a kink, it's better to control the cervical IC. Okay. Okay, I will leave my gamma here. Ташпортны. Little baby 2.18. Қазір. 3000 гепарин саласасыңыз? I'm asking for a little baby 2.5 18 and the heparin 3000 international units. Usually we don't need this torquer, and there is a indicators. Yes, you need to push only in this way. It's a very elegant French company. It was made specially for French doctors, but now it's available in Kazakhstan, and we are using the same way. If you pull it, not push in that direction, then you can lose your stent inside the hub. Yes, you should follow the instructions. Yes, we will wait water. Yes, water is coming. And now, Abzal, you can push the stent. Okay.
So I'm pushing?
Yes. As it's very important to keep the tip of the hub inside the microcatheter, at the hub of the microcatheter, very close. And then your assistant need to ask again, can I push it? Sometimes they're pushing inside the Y connector and the stent is detaching. It's very easy. And there is some technical points. All stents has a long introducer sheath. And a Candice company from Germany has only half of this length. And when your assistant is pushing the stent, it might be detached inside the brain. That's why for Candice products, it's a Derivo, Acero, Credo, Aclino. You need to keep half meter. And there is a markers. You should stop before the markers. Okay? It's very important. And the Candice products covered by the non-thrombogenic coverage, like a shield, but the name is Hill technology. Okay. On lateral view, it's very hard to control the position of the stent. That's why I'm orienting on the AP. On this screen, I'm controlling the position of microcatheter and opening the stent. Yes, now stent starts open. We say it's macaroni. Little baby macaroni. Pasta. DNA, yes. Yes. The only problem it's you can see there is a okay. Give a second. Yes, we already passed the segment. Okay. Now I should position my gamma inside the aneurysm. Yes, and there is also shipping. Yes, when you place one device and second device, all the time try to follow it. It's so-called shipping technique, and like a ship's, one ship is try to follow the second ship. It's very stupid instrument, but it works. It goes down. It's all the time goes down. Yes. Okay. Let's go up first. Yes. On AP we see the microwire is in a safe position. On AP. On lateral it looks like we are touching the aneurysm, but on AP it's okay. Yes, there is another technique. We published it in 2017 together with my good best friend from Istanbul, Kublai Aydin, and the technique is, the name of the technique, stent monotherapy. Yes, it's also possible to place just a little baby stent and okay, maybe our stent is quite distal. Okay. Yes, if it's not possible to place the stent, then we can just place the stent and finish the case. It's also possible. Okay, it's now at the level of okay, just a second. The only problem is angulation, eh? Okay, all is good. We need to go to the upper branch, and then we can just pull the microcatheter and it will fall down to the aneurysm. Usually it works like this. It's too small territory, yeah? Okay. Not an easy, eh? That's why in many places the aneurysm less than 7 mm is an indication of conservative treatment, because of the technical points when you deal with the small aneurysm. It's all the time could be challenging. Okay. When I'm trying to push it, the first it goes down, down, and then it goes up. Okay. Let's open the stent. Just a second. We'll push it a little bit forward. Now we detach the stent. Okay. As balloon is inside, it's most safe condition. And there is a second option. You can just pull the microcatheter. Now microcatheter is jailed. Eh? Okay, it's not works. Let's place it in a regular manner. Let's place it in the regular manner. We all the time have a plan B. If it will not work, then we can just leave it like this. Now it's a half T. And Yes, it's not one by one movement, that's why. So now we're inside the aneurysm.
Yes.
Okay. Okay, let's see. With the stent, we little bit shrink the volume of the aneurysm. Stent is enlarged, and now the size of the aneurysm not the similar. Huh? Okay. Stop. Means as the edge of the stent is now at the bifurcation, and stent is compressed, and then Leo baby works like a flow diverter sometimes, yes, most of the time. Okay, let's see 1.5 by 2. Сперва наш персаж, что ж плотно. Биржар мик сперва. Хелика. Оптимум. Yes, we will try to place optimal 1.5 by 2 helical super soft. If it will stay inside the aneurysm, okay. If it's not, we will finish in this condition. It's also possible. Okay. Yes, we had the data. It's very effective, and if it's not, then we now it's a half T.
Cool.
And in the future, it's also possible to place another one, Leo baby, and then it will be T-stenting. Okay. Smart mask. Stop. Okay, smart mask. Yes, and also we shrink a little bit the volume of the aneurysm with stent. Now it's a bit smaller than. Now it's a bit smaller than previous size. Okay, it's not going inside the aneurysm. I think there is no place for the coil. Huh? It's inside the stent. Okay, we'll try. If it's not go, then we can finish in this condition, no problem. Okay, now we'll inflate the balloon. Sometimes it helps to navigate the coil. It's not inside. Okay. Okay. I think we can finish like this. Stent just ended at the level of aneurysm. Okay, we pulled a little bit the micro. Okay. Let's try to trace micro core. It's not inside. Nice. It will not go. Okay. And the baby is now very dense and yes, it will shrink, and usually it could be push it. What is your experience getting from India? How many years you are in neuroradiology?
1 year after. 1 year after.
1 year after fellowship. Okay. And Rose?
Same.
Same. Okay. And fellowship was in India. Who was the mentor? Shakir Hussain. Okay. Hello, Shakir Hussain. I want to show you how it works. This is Optima coil, and when you detach inside the water, it usually no fire, but when it's outside, you can see the fire. Okay. Now it's detached. You see, it's burned. But inside the water, usually no fire. Okay. It's a helical. Okay. We already inflated the balloon, and stent is completely opened. It's also possible later on place one more additional stent, but now stent is fully covered the neck of the aneurysm, and it's a half T stenting. We didn't cover the upper branch, and it's okay. Let's follow. The first treatment was in 2023, and usually little baby in compressed manner works very well. Okay. Let's decrease the magnification. Okay. I think we already worked for 11 minutes. It's part of so-called Kazakh trombo test. Yes, it's okay. I will ask Abzal to wait till 15 minutes, and then you can do one more control angio, and then we will do as a protocol control CT. Yes, we fully covered the neck of the microaneurysm, and the stent is placed exactly in the lower branch where the aneurysm is. Okay, stent is clear. Let's see. It will work. Yeah. Okay. Okay, let's wait. And this is gravity system. It's It's a very helpful system, and I stopped swearing. It's very clear. It's clear, yes. And I have no pain in my back, and there is no pain in my knees. And Abzal at the end of the day will have a pain. Yes. But fortunately, there are 6 neurosurgeons, and they can change one after one. But I need to stay all day long. Yeah. Okay, sorry, just a second. Okay, let's wait for control. Қанша минут болды, Абзал? 13. Әлі 2 минут бар. Okay, let's wait for 2 minutes. Может, пока выключить. Okay, dear colleagues, the CT is ready. Yes, we can see the supraclinoid. Okay, first of all, the right side MCA territory is clear. No complication. The ACOM territory is also clear. And the territory of ICA aneurysm, it's partially thrombosed and still there. Okay, we need to more closely follow this aneurysm, and I think the size is maybe a little bit increased. Okay. Let's try to measure, but usually it's a problem. No? It's usually like this. Okay, histogram. Okay.
Вот все сегодня использовали? Вот на этот случай сколько использовали?
Нет, подождите. Вся расходник, да.
Checklist for the things.
Okay, I think the aneurysm size is the same. We will check later the sizes, and we'll correlate post-op and thrombosed part now, and we'll make a decision. Maybe we need to place one more stent in the future. Okay, thank you. See you in 25 minutes. Next case is parasagittal meningioma.